It's not official yet, but it might as well be. There is every indication that Donald Trump is about to pull the United States out of the Paris climate deal. Are we now a rogue nation? Let's rumble. With me for tonight's Big Picture Rumble are Julio Rivera, editorial director at Reactionary Times, and Horace Cooper, senior fellow at the National Center for Public Policy Research. Thanks to both of you for joining me tonight.
Evening.
And let's get going with this. Publicly, all Donald Trump has said about the Paris climate deal is that he'll announce his decision about it in the next couple of days. According to Axios, however, he's already made up his mind. Sources close to the administration say he's already decided to quit the deal. He's just now figuring out whether to initiate a full formal withdrawal or exit the underlying United Nations Climate Change Treaty, which would be faster but more extreme. Whatever happened to making America the shining city on the hill, the example for the world? And why is Trump trying so hard to make China the green leader in the global leader in green energy? China's budgeted $360 billion for renewable energy by 2020, which is going to produce 13 million jobs for China. Clean energy jobs right now in the United States outnumber fossil fuel jobs 2.5 to 1, 250% more clean energy jobs in the United States. This is where the growth is happening. Why is Trump walking backwards?
Well, I'll tell you this much. The only reason we don't have more fossil fuel jobs is because of regulation. Listen, climate change is a false religion. I'm here right now in the New York City studios. If you believed all the climate change models that were presented in the last 25, 30 years, right now I'd be snorkeling doing this interview because we'd be underwater. Donald Trump in the new budget is cutting spending to the EPA, and I agree 100% with it.
Julio, I'm very grateful that you have no position in the world of science. Horace, your thoughts?
Well, I echo the comments that, in fact, the very same studies that were claiming alarmist predictions actually, most interestingly, say that the Paris Treaty doesn't make that much of a difference, and those same alarmist outcomes are going to occur. The good news is that those alarmist predictions
wait a second,
haven't
Horace.
been right.
Are you talking about studies paid for by Koch Industries or studies paid for by ExxonMobil?
The very models,
or paid for by front groups paid for by Koch Industries.
The very models that predicted these alarmist outcomes that, as has just been noted, aren't actually coming through. I'm talking about the models that the United Nations uses to determine that we are at risk.
Horace, go back and look at the COP at the every 5 years the UN gets together and does their climate assessments. They've been doing it for 20 years now. Every single one, their worst case scenario, every single one, their worst case scenario has been slightly worse than what actually happened. What you're saying is the exact opposite of reality.
Tom, if you tell me that's true, then you also have to admit that those studies say that the Paris Treaty won't have much effect. So you can't have it both ways.
That's not true.
That is absolutely true. That is an absolute fact that the United
Nations... You think all these guys
Nations...
from all over the world, every country except the United States, well, maybe now the United States, every country except Syria and North Korea got together and said, we've got a crisis, we're going to sign up for this thing, and now Donald Trump wants to throw us in with Syria and North Korea.
And the United Nations...
I don't get it. I get it that you guys believe the same science that Kim Jong-un does, and that Bashar al-Assad believes. I get that. You guys are in there with Kim Jong-un and Bashar al-Assad. And apparently Donald Trump is. But I'm here with the scientists, and I don't get it.
And those scientists are the ones that say that these agreements, as voluntary as they are, aren't going to make a consequential impact on the alarmist predictions that they have made. No, that's a fact. In fact, they recommend
first of all, they would
draconian changes.
Horace, what you're saying cannot even be true because you're using the word alarmist, and no scientist would use that word.
No, I'm using the term alarmist.
You're embellishing.
But their facts are that the Paris treaties fails to take the type of changes, which I would call draconian, that would be consequential enough to change their predictions. These
So your concern before was that we weren't doing enough. Your concern now is that
no.
we're not,
My view is
that we were doing too much. Now you're saying we're not doing enough.
My view is these predictions have been alarmist. But if I believed them, then I would criticize the Paris Treaty for apparently being woefully inadequate, because that's what their own report indicates.
Well, again, fortunately, neither of you are scientists. As of today, the Trump administration has yet to say whether it will continue Obamacare's cost-sharing reductions. This is the subsidies that allow middle-class people to be able to afford their health insurance. Payments the government makes to insurance companies to help cover the cost of insuring low-income Americans. Trump's administration's decision not to share that money is a blatant act of sabotage. Trump is trying to create chaos in the healthcare market, chaos he thinks will bring Democrats to the negotiating table on healthcare reform. That probably won't happen, but what probably will happen, according to former Obama administration official Andy Slavitt, is a 19% hike in premiums because healthcare companies are trying to protect themselves against the Trump uncertainty. This, Slavitt writes in the Washington Post, is effectively a tax on all of us. He writes, quote, a tax that will be added on top of the cost of policies purchased through the individual market health insurance exchanges. So the government is going to end up covering the cost of most of these premium hikes through Obamacare's tax credits. But still, how is this the behavior of a president to sabotage health care for 10, 20, 30 million Americans?
Listen, health care was already sabotaged by Obamacare. Listen, this is the mess that Donald Trump has inherited, and you keep saying the government paying. This all boils down to taxpayers sinking more money into a broken system. We need true reform.
I hate to break it to you, but when George Washington got 3 horses shot out from underneath him trying to create this country, it was because the government is us. We the people are the first 3 words of both the Constitution and the Declaration of Independence. We are us.
That doesn't work that way anymore, unfortunately. The government is against...
Well, it doesn't. I understand it doesn't work that way in billionaire world and in libertarian world, where it's every man for himself and screw everybody else. I get that. But that's a very small percentage of people. That's fewer than 1% of Americans.
Demagogue.
I realize they own the entire Republican Party and a good chunk of the Democratic Party and much of the media. But still, the vast majority of us would really, prefer to have systems that work for all of us. Like, hey, if you get sick, you don't die and you don't go broke.
Yeah,
exactly, but you want single payer, which doesn't work anywhere. Do you want Americans waiting on a line to go see a doctor? Right now, if we implemented single payer, it would be tantamount to what's going on at the VA
Julio,
right now.
Apparently you have not traveled the world.
Veterans committing suicide because they can't see doctors.
No, I'm sorry. In the developed world, that is simply a lie. I have walked into doctors' offices in both England and Germany. I lived in Germany. Let me finish this. I lived in Germany for a year. I went to the doctor a couple of times. I went to the hospital once. My kids went to the doctor. I never waited more than 20 minutes. Nobody does. If you're going to have hip replacement surgery or something like that that's elective, yeah, you might have to wait a few months. In the United States, you have to wait a month. I had back surgery here in the United States, and I had to wait 4 months. That's worse than Europe.
Well, yeah,
come on. Single payer actually works. It's why every country in the world is doing it. But back to my question. Trump is actively sabotaging our health care system. What kind of man does that?
And it's been a bad system since 2009, 2010 when it was implemented.
The President of the United States, Barack Hussein Obama, sabotaged a system.
So what's your alternative?
That was working for 85% of us. And instead of fixing it for
the other 15% of us were dying?
Instead of fixing it for the 15, he destroyed it for people. Now, you're talking about
50% of all bankruptcies in the United States 10 years ago were caused because somebody got sick. 50%. That's down to 30% now.
Half of the bankruptcies come from that 15. Now, here's the reality. People like myself who were perfectly satisfied in the open market to buy insurance have found ourselves saddled not with a 19% increase, but nearly a 40% increase over that time. Barack Obama
because Marco Rubio did away with the cost, did away with the risk corridors.
For people
because Republicans have been systematically defunding Obamacare. Marco Rubio 2 years ago did away with the risk corridors, pulled $8 billion out of the insurance market, and now Trump is doing the same thing.
For a person who wants single payer, you sure argue a lot. You sure argue a lot.
No, this is not an argument about single payer. This is an argument about Donald Trump sabotaging health care for Americans so that...
It's an already broken system, Tom. This Obamacare system
because of Republican sabotage that is ongoing. All right, ignore all that talk about the big bad government. Republicans love red tape, especially when they're using it to demonize poor people. Case in point, the Medicare work requirements or Medicaid work requirements in the Republican health care plan. If put into place, these requirements would add another layer, a huge layer of bureaucracy to Medicare that Medicaid beneficiaries would have to jump through just to get health care, something most developed nations recognize as a right. This is the same pattern you see with drug testing of welfare recipients. Why do you guys love using big government to demonize poor people?
Because it's not the job of government to say to people who are otherwise healthy, otherwise able, that some other person is going to pay for your day. If you want to be a painter,
the vast majority of people on Medicaid, Horace, are either elderly or are children. The vast majority.
That's not true. And by the way, even if true, your mission and the other progressives is to increase that number every day to lower the barrier so more and more people who are
until everybody in America has health insurance.
In fact,
has health care.
If that were true,
let me ask you, Tom,
a work requirement wouldn't have any effect.
Hey, let me ask you a question, Tom. Back in the 90s,
we got to wrap it up. Julio, you get the last word. We got to wrap it up here. Julio Rivera, Horace Cooper, thank you both for being with me tonight. I appreciate it.